Today we're going to talk about that snatched jaw. Like everyone wants to be snatched, or at least that's the term that we hear. And that can be many things for many people, but what we're really going to dive into is when is something minimally invasive better or acceptable versus something more surgical, something deeper. We see patients regularly who come in looking for something more minimally invasive, but because of anatomy or their overall goals, do definitely need something deeper, something that directly addresses the deeper structures like the platysmal bands or visible digastric muscles, or even submandibular glands that have started to become visible through time and age. And then, probably more than anything, the lax skin. Patients who are good candidates for the minimally invasive tend to have better skin quality, do not have significant or visible deeper structure issues, have minimal to no anterior or the platysmal bands, the bands that start to come down like little railroad tracks here. Those patients are much better candidates for, and maybe even a little bit of extra fat. Those patients are going to always be better candidates or better options for less invasive or minimally invasive treatments like the ultrasonic liposuction and Renuvion that I really enjoy, because it is so valuable, even as a bridge sometimes to a better or a more significant procedure a few years down the road, because we do find that it lasts probably about 5 to 7 years on average. Some people get a little bit better, some people get a little bit less, but typically about 5 to 7 years. And for something that can be done under local anesthesia with a relatively limited recovery time, it is excellent. And as you can see on the pictures that have been on your screen, patients can do extremely well with this, but they have to be willing to accept and understand the limitations that it has relative to surgery. It is not always going to get the jowl as completely. It will definitely not get the more significant bands. Sometimes smaller bands can be fairly significantly minimized. It's not going to take up a tremendous amount of redundant skin because it just doesn't take away those things. So if you feel like you are looking to have a more refined, cleaned up, youthful looking jawline, but don't know what your options are or what option is best for you, please come see me. I'm Dr. Paul Ruff at West End Plastic Surgery, and I look forward to seeing you.